Good afternoon and welcome to our weekly press conference where we're providing information to our community on the COVID-19 pandemic. I'm Larry Holsey, Director of Municipal Information and Communication for the city. I'll be your moderator for this. In a moment I'll introduce our panel, but before we do that I want to remind everybody that we are inserting an American Sign Language translation for those persons. We're also providing recording a complete Spanish interpretation of this, everything that's being said, that will air this afternoon at 4:30 on our channel for all the Spanish-speaking population. And always so gracious to come and be a part of our opening here is Council Member and Mayor Pro Tem Hector Sabito. Hector, you'll also, we want to invite everybody to the town hall meeting that your strategic communication group that was appointed by Mayor Deaver, you're the co-chair of, having a special Spanish only tomorrow night, so talk about that too. So take it away.
Yes, sir, Larry. Thank you so much. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando en español en vivo durante esta conferencia de prensa. Esta grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en wccc.tv. También les quiero invitar a todos los que están escuchando y viendo este video que mañana el jueves va a tener un ayuntamiento virtual a donde vamos a hablar de la vacuna de COVID-19. Va a haber profesionales médicos y líderes comunitarios. Puede ver la historia en el canal de cable de la ciudad de Waco, el canal 10. Lo puede ver en la página de Facebook de la ciudad de Waco o también lo puede ver por internet en wccc.tv. Larry, thank you so much for the invitation.
Thank you for also helping host and provide that information tomorrow night on our channel as well. Today, I'd like to welcome all of our panelists who are participating with us today. Certainly our Mayor, Waco Mayor Dylan Meek, McLennan County Judge Scott Felton, Dr. Jackson Griggs, CEO of the Family Health Center, Dr. Brian Becker, Chief Medical Officer of Ascension Providence, Dr. Ahmad, Interim Chief Medical Officer for Baylor Scott & White. And we will have a special guest in a moment that Mayor Meek will introduce. We'll start off with our opening comments, and then following that, we do have 4 media representatives online, and we'll have each one of those be able to ask at least 2 questions, and we'll get to that after that. But let's first go in the order of starting off with our mayor first, then County Judge Scott Felton, followed by Jackson Griggs from Dr. Jackson Griggs from CEO of Family Health Center, then Dr. Ahmad from Baylor Scott & White, and following that, Brian Becker from Ascension Providence. So, Mayor, kick us off.
Good afternoon. I appreciate everyone taking the time to join us today, especially those panelists on this call. I know each of you are so busy. I'll give update on the vaccinations here in a moment, but first I want to start by thanking our hospital personnel and our health district and city staff members and county staff members who are working around the clock while exercising good care and compassion and are undoubtedly exhausted. Thank you for what you're doing for our community. Dr. Matt Patillo is on the call today, and he is going to share some of his experiences with us here in a moment. I'm looking forward to hearing that. I think that we'll all be benefited from hearing his perspective from these last many months. Our local hospital systems, our city staff, our county judge and myself are in close, regular contact with one another as we discuss and monitor data regarding our hospital capacity and hospital personnel and monitor whether or not there's a need for an alternative care site. To date, this still seems to be more improbable than probable, and our hospitals in Waco McLennan County Office of Emergency Management have developed robust plans to keep our population safe should a number of hospital patients increase to a degree of serious harm. Our local doctors continue to advise us of the seriousness of this virus, and I urge our community to also make wise decisions in the days ahead by following these doctors' calls to wear masks in public, follow safe distancing protocol, and wash hands. Following these doctor-endorsed protocols make this situation not as fearful. And as a reminder, at the present time, Texas mayors and local governments have almost no policy-making authority. Governor Abbott has implemented and has control of the regulations and mandates, from the wearing of masks to the closures of bars and occupancy requirements. The governor has issued an order stating we can't issue more restrictive orders than him, and we have not heard any word from the governor's office that any of this might change. The Waco-McLennan County Emergency Operations Center is working with the Texas Department of Emergency Management and DOC's health testing to provide free COVID-19 testing to the community. When you register online, it does ask for your insurance information, but you don't have to have insurance to receive the test. And for people with insurance, there's no out-of-pocket cost or copay to get the test. Just go to covidwaco.com to register. And remember, we're still offering free testing here in our community. The Waco-McLennan County Emergency Management Office previously received a refrigerated truck to be used as a temporary morgue. This refrigerated truck is currently housing 19 remains. But in spite of that, this is still a time for hope. People in McLennan County are getting vaccinated, and we celebrate that. As a reminder, there are many local organizations giving vaccines at this time. We call these vaccine providers or just providers. A list of these providers is available at covidwaco.com, and these include places like CVS, HEB, Berkshire Brothers, and that also includes Baylor Scott & White, Providence, Family Health Center. People on this call are representing organizations that have thankfully received these vaccines. And then one of these many providers is our own public health district. Of these providers, 2 have been selected by the state of Texas to serve as local vaccination hubs to get vaccinations quickly to all eligible 1A and 1B recipients, regardless of residence. These 2 hubs are our public health district and Ascension Providence. Hub sites get larger quantities of vaccinations than other providers, and this week the health district has gotten 1,500 doses. As a reminder, local government has no authority or control over any of the providers, but we do work to collaborate and partner with providers when we're able and willing to do so. And now for an update on the Waco-McLennan County Public Health District's vaccination clinic. Yet again, staff has been working really hard to serve our community and was able to administer all doses without wasting any vaccines. Many vials even contained more than an average of 10 doses per vial, and staff were sure to utilize all of it. 1,618 people were able to be vaccinated in the 2-day clinic, and I am so thankful for the care and effort our staff, partners, and volunteers put into every aspect of these events. We have received another shipment, as I mentioned, we have received another shipment of 1,500 doses and are hosting another vaccine clinic this week at the Waco Convention Center on Thursday, Friday, and Saturday. We were glad to be able to make a weekend clinic day available for those who are unable to make it during the normal work week. We did not open a registration portal appointments for this clinic. Staff worked with the wait list to schedule appointments and reached out by email and by phone to the contact information provided in the wait list. Staff is working diligently to make sure this is fair and equitable for everyone. I acknowledge that many citizens have tried to register for the vaccine with us and were unsuccessful, and I hear that. And that this process has been frustrating for so many. This registration process was unable to accommodate the initial volume, but the process has improved and the website will continually be updated to provide clarity. People should be encouraged to continue to log on to the website, read updates and emails, and sign up with our public health district's waiting list. If you did not get an appointment for this week's clinic, please be patient. Demand continues to outweigh supply, and the health district is still only receiving the 1,500 doses per shipment. We will continue to get consistent shipments of the vaccine allocations from the state, and we will continue to move through the wait list and host clinics. We are not scheduling appointments until the allocations have been physically received. If you have signed up through any of the prior lists, you are on the wait list. We did not throw out any of the previous list or contact information. Please continue to encourage those you know who are eligible for the vaccine to get on the wait list and help them. You can help them. If you know someone who might not be as technologically savvy or maybe doesn't have access to a phone, be their aid, come to their aid and help them get on the wait list for this vaccine. The waitlist link is available online at covidwaco.com. look for a big red button labeled vaccine waitlist registration. And then the call center is available to assist with any questions or registration you might have, and that is 254-750-1890. You are being a responsible, good citizen for signing up for the waitlist. The waitlist is over 20,000 people, and that is a testament to how well our citizens are responding, and Waco should be proud. Your public health district is committed to working through this list, and you should know that by signing up, you are helping Waco understand who needs a vaccine and how best to get it to people with different needs. As we continue to move forward with these clinics, it is so evident that these events are a community effort. So much goes on behind the scenes that make these clinics run smoothly. I would like to thank our community partners who have helped the Waco-McLennan County Health District make these clinics happen. Baylor Scott and White Hillcrest, Baylor University, Louise Harrington School of Nursing in Dallas, McLennan Community College School of Nursing, Tarleton State University School of Nursing, the American Medical Response EMS Services, Central Texas Medical Reserve Corps, and all who have volunteered through that great organization, the Heart of Texas Red Cross, McLennan County, the City of Waco Fire, Office of Emergency Management, Police, IT, Waco Convention Center, and the many employees who have pivoted to help work the call center on weekends and after hours. I would particularly like to highlight this week that Waco Transit is providing free rides to the vaccine clinic through the demand response van. Call 254-750-1620 24 hours in advance of your appointment to schedule a ride. City and county leadership and the public health district staff are working hard with limited information about shipments of vaccines. Communications are and will continue to be challenging, and your patience is appreciated. We will continue to communicate through our weekly update emails, our website, this press conference, social media, town hall meetings, by the way, one of which was done last week with a variety of community leaders, including Commissioner Miller and Councilmember Bearfield. And as Councilmember Sabito mentioned, another one's coming up. We'll also continue to have coordinated messaging and outreach to neighborhood associations, local faith communities, local businesses, grassroots organizers, and other nonprofits, with a focus on ensuring vulnerable populations are given a fair and equitable access to the vaccinations. Finally, some telephone numbers to call. As I mentioned, our health district has a supported bilingual call center, and that is 254-750-1890. And it provides vaccine information or assist clients with registration for the vaccine clinic through our online portal. And we also have our public information bilingual hotline, which is 254-750-5606, with recorded up-to-date COVID-19 and vaccine messages and resources. While there hasn't been a coordinated and clear national plan regarding the distribution of vaccinations, I'm thankful for our community partners, like those institutions represented on this call, who've stepped up to collaborate and ensure that vaccinations are equitably distributed, and who are working so hard to make Waco safe and healthy. So I appreciate that, and with that, I'll turn it over to Judge Felton.
Judge Felton, let's hear from you, sir.
Good afternoon. I want to remind everyone that the Waco McLennan County Public Health District is a vaccine hub for the state. The expectations of the hub program are that all state hubs will maximize vaccination efforts across the state to quickly administer all vaccine doses to eligible individuals, regardless of what county they come from. Individuals from 42 counties were served by the clinic last week here in McLennan County. That's approximately 77% of those folks were McLennan County residents. And I would remind you that many of our residents have gone to other counties to get vaccines as well, just in search of an opportunity to get the vaccine as quick as possible. The state also expects that there will be an equitable distribution to the hardest hit zip codes and the demographics, and we continue to make efforts to ensure that our entire community is represented at the clinics. We are glad to partner with the state on these efforts and provide this much needed service to our community. Unfortunately, 1,500 doses just doesn't go far enough. we are continuing to work with local and state levels to advocate for an increased dosage to our vaccine clinics. We're in close contacts with our state representatives and our state senator here as well to help advocate for us to receive more vaccine, and encouraging the state to understand that we have the ability to provide efficient way to deliver these vaccines to the community. If you are still waiting on an appointment at the clinic, I encourage you to keep checking with local medical providers and with area pharmacies for vaccine availability and getting on their wait list as well. We have over 20,000 people on the health district wait list, and it will take us many clinics to serve that many people. There is a link to the state's vaccine provider map on covidwaco.com, where you can look up all the providers in our area and the contact information for them as well. In the second week of February, we will see the first 1,500 people that have received their first vaccine in the time frame between January 12th and the 14th, who now need their second dose. If you received your first dose from the Waco-McLennan County Public Health District, you will be contacted directly by the health district at the phone or email that you provided to schedule your second dose. The state currently is recommending that you get your second dose from the same provider you received from your first dose. They are providing the matching second dose allocations to providers after the appropriate time period from the first dose. Under the guidance, the health district is receiving second dose for those individuals who received first dose with the health district. While a lot of the focus lately has been on the vaccine clinic, please also remember that free COVID-19 community testing is still available. Testing is an essential part of slowing the spread of COVID-19. You can view testing locations and access to registration links through the covidwaco.com. Online registration is encouraged and walk-ups are welcome. This is a saliva test and not the brain tickler, as we like to call it. This will not the invasive swab, but you hopefully will get your results back in less than 3 to 5 day period. When you register online, you will be asked for your insurance information, but it's not required by appointment. I will tell you that testing is slowed. I know for a fact that it has kept people from being exposed that might have been otherwise, where meetings were set up on face-to-face, and someone ended up we were asked people to get tested before the meeting, and someone seems like would always be one to come up with a positive test. And so by canceling or doing it remotely or virtually, we were able to keep from spreading the virus. So look forward to hearing the other panelists make their presentations. Thank you.
Thank you, Judge Felton. We're going to go back to Mayor Meek, and he's going to introduce his special guest that he included today. Mayor Meek.
Today, we're really thankful to have Dr. Matt Patillo joining us. Dr. Patillo can tell us a little bit about himself, but he has been one of the frontline workers who has diagnosed and provided care to many COVID patients here in Waco, saved many lives in the last several months. And we wanted to bring him here today to share some of his experiences with us. And so with that, Dr. Patillo, we're so thankful that you're here and look forward to hearing some of your story and sharing some of your experiences. And if you have any advice for people here in Waco in the days and months ahead, we look forward to hearing that as well.
Great. Thanks, Mayor Meek. I appreciate it. Thanks for having me here. So that was good news, what you said. There's 20,000 people on the wait list for vaccines. That's great. Guys like me like to hear that. So, it's been pretty busy here over the last several months here in McLennan County. I'm a pulmonary critical care doctor at Ascension Providence here in Waco. And we've been busy. Our ICU, We have a 30-bed ICU. It's been full pretty much the majority of the last several weeks. We've had to occupy beds in our post-surgical care unit as well, and we've even had some intensive care patients on the floor to help care for some of these patients who become critically ill with COVID. One of our big rate-limiting steps in caring for these patients has been people to take care of them. We've had nurses and respiratory therapists that are doing a tremendous job to take care of these patients, but quite frankly, there's been so many patients here in the last several weeks that we've had to call in FEMA, which is a federal emergency management agency, to help us with some nurses and some respiratory therapists that have really helped us tremendously in caring for these patients as the pandemic continues. So the real true heroes of this have been the respiratory therapists and the nurses who, every day are going to work and taking care of these patients who are pretty time consuming and time intensive, and there's just a lot of them to take care of. So it's been interesting over the last several weeks.
Thanks, Dr. Patillo. Any advice that you give to just Waco citizens in this time from a medical perspective? What counsel would you give anybody?
I have kind of a unique position, I think, with COVID. I've had COVID and fortunately didn't get it very badly. I've had lots of friends and some family who've had it who don't get significant symptoms. So there's that face of COVID, which thankfully is the most common face of COVID that many people will see. I see the face of COVID that goes to the hospital, that needs some oxygen and some extra help for a little bit, who don't become acutely ill, but who need to be hospitalized for several days for oxygen therapy. We've had 100 patients or so in the hospital at any given time over the past several weeks. And most people that go to the hospital, if you have to go to the hospital, it's not necessarily something that you're not going to come out of the hospital or you're going to go on a ventilator. Most people who go to the hospital leave the hospital and they go there for several days and they get better. Unfortunately, I have the opportunity too to see the face of COVID that can get really ugly. And the patients who come down to the intensive care unit who are critically ill with COVID, and we've had a lot of those, Dylan, we really have. And I think COVID, unlike other illnesses that we've taken care of, is people come in when they get really sick with COVID and they're scared because they hear about what can happen with the disease. And it's been a real challenge for us to kind of comfort them in this time. Families are having a hard time coming in to see them. We try to do Zoom calls with them or FaceTime calls with them so that they can keep up with their family. But I think I would urge the community that, while thankfully COVID is benign or not benign, that's a wrong word to use, mild in most people, be sensitive to the fact that there's a lot of people and a lot of families out there who are really grieving with people they have lost and people who have become critically ill with COVID. It is a very life-changing illness for many, many families in our community. And just to be sensitive to that and to do the things that you mentioned earlier, to be smart and wear your mask and wash your hands, stay away from large gatherings. No one's telling you to stay in your house and not to ever leave your house, but be smart about it and take the vaccine. The vaccine is a safe vaccine. I've been vaccinated. Most of my friends and family are on list to be vaccinated. A lot of the healthcare workers that I know have been vaccinated with very few side effects at all, if any. So I think it's a safe vaccine and really do urge our community to go forward and receive that vaccination.
Thanks. Thank you so much, Dr. Patillo. Any other of the panelists have any questions for Dr. Patillo at this time? If not, Dr. Patillo, we're so thankful for you taking time to share your experience. It means a lot. Thank you for serving our community, and please tell your team and your colleagues how much we appreciate their hard work in this season to keep us safe and healthy. And again,
I'll do it. Thank you so much for having me. I appreciate it. Thanks.
Yes, sir. See you, man.
We do. Thank you. All right, let's go to Dr. Jackson Griggs, CEO of Family Health Center. Dr. Griggs.
Thank you. And Larry, and before Dr. Patillo, I'm not sure if you're going to stay on the whole time or if you're going to leave, but I'm glad I caught you before you signed off.
I'm still here.
Oh, good. It's been a couple of years since we've worked on a case together in the hospital setting, but during the past year, I've thought so much about you and your critical care colleagues who are I've seen you take calls at 3 a.m. I've seen you come in when you've already had long stretches of work, and I know that you're doing that now on a regular basis. So I just think I think in as much as I can speak for our community, just so very deeply grateful to you, to the other critical care docs, to the nursing staff, the techs. It's just tremendous what you guys have done over the past year, and I think all of us just salute you and your courage and your service and your heart. So thank you.
Well, thanks a lot, Jackson. That means a lot. I appreciate it. Thank you.
And thank you, Mayor and Judge and Larry, for the invitation back. I'm just going to jump right in. McLennan County, our total number of confirmed cases in the county to date is 22,994, 868 of which are currently active. As of this afternoon, the Public Health District has received notification of 148 new cases of the novel coronavirus. 120 people are hospitalized currently with COVID-19. 28 of those who are currently hospitalized are requiring ventilator support. We have 2 additional deaths to report, which brings our total death count in our county to 358 deaths since the pandemic began. Within elder care facilities in McLennan County, currently there are 15 facility outbreaks. There are 24 active cases among patients and staff in these facilities, and there have been 122 nursing home associated COVID-19 fatalities to date. At the county jail, there are currently 27 active cases. There's 1 current church cluster identified within McLennan County. There are 14 independent school districts and no private schools that are reporting cases on campuses. There are a total of 45 individual school campuses with active cases. And within schools, there are 110 active cases. And among those 110 cases, 67 are students and 43 are staff. Now going to share my slides here to provide an update on incidence and positivity rate. I've been the bearer of so much bad news. Today's a good day because I'm sharing that our incidence numbers have been on a downward trend now for 2.5 weeks. This I'm going to show with my cursor here, this peak right here just before we began the decline in new cases per day, per 100,000 on 7-day rolling average. This spot right here was on the 9th of January. And you can see now we're at 23 new cases per day per 100,000, which is below the United States and the state of Texas. You can also see that using the strata from Harvard Global Health Institute, we are now in the out of that red zone that's indicated following that tipping point where we're at such high risk of exponential spread. And while we do see in this strata, we see plenty of community spread. We are at least not at the same risk, perhaps, of exponential spread that we were even 2 weeks ago. So that is positive news. We still have a long way to go before we are safe from hospitals getting overburdened, and before we'll see only just rare death. We still have a positivity rate that's 14%, which is higher than we want to see it. We'd like to get that positivity rate down below 10% and ideally less than 3%. We need to test more in our community, and the only way that we can identify more asymptomatic cases and mildly symptomatic cases are if folks get tested. So please continue to use the community testing service that's available. Reach out to your primary care clinician. If you have mild symptoms or if you think you've had an exposure, please get tested. That's the only way we're going to bring the positivity rate down and find all the cases that exist in our community so that we can isolate and quarantine and stop this virus in its tracks. This line graph represents the 14-day running average of the bar graph underneath, which is daily hospitalizations in our community, Ascension Providence and Baylor Scott and White Hillcrest. And what you see is that over the past week and a half, you have seen a downward slope of that average, which is, again, good news. Although even in the last couple of days, the numbers have kind of begun to flatten. So I don't want to let me say it like this. It would be easy to be too optimistic. It would be easy to overstate the good direction that we're headed in here. I want us to be wary of sort of prematurely sounding some note of optimism too strongly, just because I think that we're not really to that place yet. We will hope that in another week or two we'll see a steady downward trend, but it might be a little premature yet to be optimistic. The number of fatalities by month, to reinforce that December was our worst month in terms of fatalities, and January, now 27 days in, we've seen 70 deaths. We likely won't reach the same mark that we saw last month, but it will clearly be the second most highest month of fatalities in our community. I want to speak briefly to the variant, the B117 variant that I've spoken about before. And the reason I want to share this is because I've said multiple occasions that this variant, that there was no evidence that this variant was more virulent, more likely to cause harm, but just more transmissible or more likely to be spread. Well, I'm revising that previous comment today and sharing that there is some evidence now that that this variant that was in September discovered in the Kent region of England may actually be more virulent and more transmissible. Yesterday, the British Medical Journal reported in a brief that the United Kingdom's New and Emerging Respiratory Viruses Threats Advisory Group found that the mortality risk was up to in the range of 30 to 90% more fatal than the more common strains. And this was corroborated by the UK government's chief scientific advisor, who said that his comment was that the mortality was 30 to 40% higher, and then followed up with the fact that more research would be needed to confirm that fact. So just some early evidence pointing in the direction that this variant is more fatal. I think that only reinforces the importance of the measures that we've been talking about for months, which is to stay home as much as possible. When you go out, please wear a mask and avoid crowds, clusters of people, and when you are around other individuals, non-household members, make sure and socially distance at least 6 feet. In terms of whether this variant exists in our community, the CDC is performing random sampling across the country. I'm not aware that Central Texas is one of its focus areas. I'm not aware that any samples from McLennan County or from Central Texas have been delivered to the CDC that would reflect this variant. But at the same time, we've seen that this variant's in multiple states. If it is indeed more transmissible, as the current evidence suggests, then it's only a matter of time before it reaches our community. So again, I think acting right now as if it is lurking out there among us is prudent. So all the more reason to get vaccinated at our first opportunity, and again, to maintain those health behaviors that are so critical. And then lastly, I received a couple of questions that I wanted to speak to. One is about double masking and whether that is useful. There's an engineering professor at Virginia Tech, Lindsay Marr, who shared on an online medical resource in November. So this is not published in peer-reviewed literature. This is a study that she and her lab performed from Virginia Tech, and it was posted online. They looked at 11 different face coverings and how those face coverings filtered particles of different sizes, and they demonstrated that a 3-layer mask filtered out 90% of risky particles, and recommended that a 2-layer tightly woven fabric mask with an inner layer of filtering material like a cutting from a vacuum bag, or a surgical mask plus a double-layer cloth mask would maximally filter out particles. But I think it's important to say here that in the discussion about masking, I mostly just want to affirm that our community has just grown tremendously in its shared willingness to mask outside the home. And that is by far the most important thing. These more nuanced conversations about layers and types of masks, I think are secondary to the fact that we're all taking care of each other by just consistently keeping our noses and mouths covered. If you do happen to be in a high-risk setting, particularly if you're using a homemade mask, it might be worth using a mask with multiple layers. The other question is one about medications, prescription medications or over-the-counter medications, and whether medications change the outcomes for those who are positive for COVID but not hospitalized. And I guess I'd start by reminding folks that early suggestions that certain prescription medications help prevent clinical deterioration in those who test positive, that these early hopes really didn't pan out in subsequent studies. And in fact, there's growing concern that too many prescriptions for antibiotics have been prescribed during this pandemic. And we could, in fact, see a rise in antibiotic-resistant bacteria because there have been some eager prescribers who have prescribed antibiotics without real clinical indications. So I do worry some about overuse of antibiotics. As we've mentioned before, there are certain instances when an IV antibody infusion is appropriate for those who are at very high risk of hospitalization or death due to comorbidities or age. Bamlanivimab is the monoclonal antibody that has the FDA emergency use authorization for that purpose, but it remains very expensive and in short supply. And in terms of over-the-counter medicines, the best advice I can give is just talk with your primary care team. If you have symptoms, there may be some over-the-counter treatments that can help sort of limit some of the symptoms of the immune response when your body's fighting COVID, but there aren't over-the-counter medicines that would shorten the duration of the disease or reduce your risk of hospitalization or other complications. And that is the report that I have for today.
Thank you very much, Dr. Griggs. Now let's go to Dr. Ahmad, Interim Chief Medical Officer for Baylor Scott & White. Dr. Ahmad.
Thank you, Larry. And thank you, Mayor, and thank you, Judge Felton. I also want to applaud not only Dr. Patillo, but all the providers, nurses who have been in the front line, our ER providers who have been taking care of our COVID patients since March, since it hit us. At the time, we didn't even know how deadly it was, and they put their lives at risk. So thank you for all the services you provided. My message from Hillcrest is actually a little more promising, just like Dr. Griggs was also mentioning. The numbers have started trending down, and we are hoping that this trend continues. And that can only happen if we continue wearing the mask, washing the hands, and keeping the social distance. Please do not take this positive trend as a signal for us to avoid any kind of social distancing and the things you're doing good. Those are the reasons we are able to move in the right direction. Plus vaccines, which is also helping us. As you already know, Providence is the hub, city is the hub. So we are working with the city and Providence also in finding avenues and sharing the resources so that we can provide vaccines to our community. We still have a good supply of ventilators. In spite of most of the patients who are in the hospital are the sickest one right now, we feel that light is at the end of the tunnel. And last but not the least, I do want to applaud Mayor, all the efforts and the city efforts, the information you're providing and updating the website and keeping the team ahead of the curve in providing the vaccination and the investment you are putting in, and including the free services and the transportation you're providing. Those are an exemplary that we need to follow in different counties also. So thank you for that, and that's all from me.
Thank you, Dr. Ahmad. Now let's go to Dr. Brian Becker, Chief Medical Officer with Ascension Providence. Dr. Becker?
Thank you, Larry. I'd also like to thank Matt, Dr. Patillo. I thank Matt pretty regularly. He has done yeoman's work along with his partners here in our ICU for a year now. So thank you, sir, for your level of commitment, integrity, and hard work. So thank you, sir. I think that it's interesting to always look at Dr. Griggs' graphs. We live in this world, and I see that and I feel that, and it's nice to see validation on a chart that what I feel is actually what the numbers are reflecting. So Dr. Patillo alluded to some declining ICU volumes. We certainly have seen that over the last week. I'm hopeful that trend continues. That would allow us to open up some. Our overall hospital capacity is still over 100% and has been for 2 months now, but is coming down. So that's nice to see. So the areas that I've spoken to that we have stretched into our post-operative recovery room, which has essentially been an ICU for the past month, is still an ICU and is still quite full of critical patients, but we are seeing some declining numbers there. Our outpatient services area that we had transitioned into a med-surg unit, also seeing some contracting volumes there. So I'm hopeful if this trend continues that we can begin to return to some normal services in those areas, which would afford us the ability to begin to do some more procedures. We have not done an elective case on our campus since December the 2nd. So that's almost 2 months of deferring cases, holding cases. We have done emergent, urgent cases. We have done cancer treatments. We have done those things that we consider necessary. And it would really behoove our community to be able to get back to some more normal levels of activity across all fronts. I think people can really appreciate the direct effect of this virus. So they see someone, they know someone who got sick, got admitted to a hospital, may have ended up in an intensive care, and may have ultimately passed away from this disease. I think people can appreciate all that. Certainly everyone understands the impact on their day-to-day activity, wearing a mask, limiting their outings in public, family gatherings even have been restricted. But it really goes beyond that. So as our nation has geared up to try to address this need, we see issues in other areas. And I'd really highlight some lab concerns that we have. So manufacturing has has focused on the ability to produce testing for coronavirus at the expense of other tests that they generally produce. So over the past week, the equipment, the machines, the technology that we use to identify bacteria, bugs, from a simple pneumonia, sexually transmitted disease, those tests are not available. I can't get them, so we have to revert back to older technology that may take us 2 or 3 or even 4 days to get an answer back, where it used to be hours. And so I think it's important to recognize that there's significant bleed over from a year's worth of trying to fight this pandemic into multiple areas across all of healthcare. So I just really wanted to highlight that. I think that's off the radar. I think it's not something people appreciate, or all the ripple effects of what this pandemic has done across healthcare. We do continue to function with FEMA nurses, STAR nurses. They have been a huge benefit to us to allow us to care for the increased volumes of patients in our hospital, and have been warmly welcomed in our facility and others, I'm sure. Morale remains high. Our nurses, our physicians, all the associates across the hospital continue to take great pride in the work that they are doing in an effort to provide care to not just our COVID patients, but to all of our patients. So again, as every panelist has said, thank you to all of those folks. And we continue to see that same sentiment from all members of our community. So that's nice to continue to see that. I think moving forward, I continue to hope that we'll see declining numbers, that our hospital and our community can return to normal. And I think to do that, it really is important for people to sign up for a vaccine when at all possible. As has been mentioned before, we are a hub. We have received vaccines. I think, as every hub across the state would tell you, you never know what number of vaccines you may get. You never know if you'll get them. I can't guarantee that I will get any again next week, but I am proud to say that by the end of this week, we'll have given 8,500 vaccinations. And those don't necessarily mean we gave them. So we have passed some of those off to other organizations to give. It is, in my mind, a point of access for this community to receive vaccine. And our overarching goal still remains to strengthen and protect our healthcare workforce, and to support those persons who are in the highest risk group. And we continue to follow CDC federal and state guidelines on who should receive those vaccines. So again, a great deal of work has been done across our community from multiple organizations to try to get vaccinations in patients' arms. So thanks to all those folks who have been working diligently on that. Larry, I'll turn it back over to you and look for questions.
Thank you, Dr. Becker. All right, let's go to the media. We have 4 representatives from various media outlets today. We have Rhiannon Sagert with the Waco Tribune-Herald. We have Hannah Hall with KWTX News 10. We have Andrew Moore from KCEN Channel 6. And Brishavia Jordan from Fox 44. And we'll go in that order, and each one will get one opportunity to ask a question. Then we'll make 2 rounds so everybody will get 2 questions. So Rhiannon Sagert with the Waco Tribune-Herald. Are you on the line?
Yes, hello. I hope you can't hear the lawnmower in the background. My question is for Ascension Providence, as we go forward and you continue distributing the vaccines, will Ascension Providence have a model more like what the public health district is doing, where there's a wait list and it's sort of for the public?
Yeah, thank you for the question. And I will tell you that we do have a team of folks working on vaccinations, and we work in concert with our market, which is primarily out of Austin, on what that looks like. To be honest with you, we have really struggled trying to figure out a public-facing access point, a tool that allows our community to register and to sign up on a wait list. It is a body of work that we are attempting to address at the present time, and we have numerous resources focused on that particular issue. At the present time, we do still continue to utilize our clinics as a resource, a vaccination site. We are focusing on our 1B patients that we can reach out to. Those patients do reside in all of our service area. So we are making every effort to be equal in those folks that we reach out to sign up for vaccinations. In addition to the doses that we give through our clinic, we continue to offer vaccinations to frontline healthcare workers. And we continue to, in turn, share those vaccines with others across our community. So if we can help Dr. Griggs and Family Health Center with some vaccine doses, we will do so. We are also, as Judge Felton pointed out, really tasked with not just addressing our community, but all of our community, which is our region. And so we are working with Hill County and can we put together a plan for Hill County to have a distribution process that meets our state's guidelines, and other rural sites where we can administer vaccines. We are working with pharmacies across areas of our community who have lists of patients that are requesting vaccination as well. So we will work internally to build a system that allows us to begin to populate a wait list and formulate a means for administering. But short of that, we will continue to partner with all in our community who can continue to provide those vaccinations.
Thank you, Ron, and we'll be back with you in a moment. Let's go to Hannah Hall with KWTX News 10. Hannah, you're on the line?
Yes, I am. Can you all hear me?
We sure can. Go ahead.
Great. Anybody can answer this question. This isn't necessarily specific, but we know that there are a lot of wait lists in our community right now. Is it effective for people to get on multiple wait lists, or does that kind of bog down the system if one person is on, say, 5 different wait lists for a vaccine?
I'll take a stab at this, and I would really appreciate someone to clean up anything I say mistakenly. And Kelly, I'm going to speak on our process locally or at the health district. So if I say this wrong, let me know. Right now, we are encouraging people to get on wait list. It would be preferred to have one coordinated effort, one national system by which to do this, but that is unfortunately not how this is played out. If you are on the wait list and you for the public health district and you are able to cancel your appointment, and we will fill that spot if someone, in the event that someone does not. If you do get a vaccine somewhere else. Is that correct, Kelly?
Yes, that is absolutely right. We are taking people's names on the wait list, and we appreciate it when they call and cancel if they're able to get another vaccine, but we're not denying anyone on the wait list, so we encourage people to sign up however they can.
Okay, Hannah, thank you very much for your call. Stand by. We'll be back to you in a moment. Let's go to Andrew Moore with KCEN Channel 6. Andrew?
Yeah, hi. This question is for Brian Becker. According to state data, over the last 3 weeks, you guys have gotten over 5,800 doses of the vaccine. The health district has gotten about 4,500. We know they've given all of those out. And of course, we have reached out to DSHS about this and said that, you know, these efforts are supposed to be public facing. Is there going to be any sort of partnership with the health district to get those doses out faster and in a more of a community effort that is public facing?
Thanks for the question, Andrew. I would tell you that we are constantly in communication with city and county officials on what does our vaccination effort look like. So we're working in conjunction with those folks as well as Family Health Center and Baylor Scott and White Hillcrest. So we continue to work with all of those. I will tell you that it is a misconception that there is an allotment for McLennan County and it's half because we have 2 hubs. We are fortunate to have 2 hubs. which essentially doubles the volume of vaccines that we can get. So it's not a halving of vaccines between two hubs. Our efforts initially focused internally on healthcare providers. That wasn't just Ascension healthcare providers. We shared vaccine with Baylor Scott and White Hillcrest, with Family Health Center. We offered vaccinations to AMR, our fire and police, and independent offices. So I don't want it to be confused that because those vaccines are delivered to Ascension Providence, that they stay within Ascension Providence. They have been distributed across our community. Those vaccinations that are being administered across our clinic are administered to people in our community. They are our patients, but they are our community members. And so every vaccine that we have given has been to the benefit of our community and to members of our community, and will be moving forward as well. We continue to try to develop spokes in this hub and spoke model, and that has been our drive since vaccination started.
Okay, thank you for your question. Let's go to Brinshavia Jordan with Fox 44. Brinshavia, are you on the line?
Yes, I am. Can you all hear me?
Sure can. Go ahead.
Okay, this question is going to be for Kelly Crane or Mayor Meek. I wanted to know, I know that the Public Health District did a survey and they were awaiting the final data, and I wanted to know if the data was complete for the survey.
Kelly, if you want to take that. Yeah.
Sure can. Thank you for that question. We just wrapped up the survey. So at this point, our epidemiologists and health educators are working through the data, cleaning it up to understand. It was a short survey on vaccine opinions and what people thought about vaccines. So we should expect final results shortly. It just wrapped up this week.
Okay.
Okay, thank you. We'll be back to you in a moment for another question. Let's go back to the top of the list now for our final round with Rihanna Sagert with Waco Tribune Herald. Rihanna, you have another question?
Yes, just one about the CDC updating their guidelines as far as spread among younger children. Apparently, it's less likely to be spread through younger children, but more likely to spread through teenagers or through, of course, something like sports. Would that change? Should schools kind of change their approach at all based on that information?
Yeah, Jackson, you want to take that?
Brandon, you're ahead of me this week. You beat me to the CDC guidelines apparently, so I need to do some reading. Thanks for pinging us on that, and I'll just have to take a look at it and get back with you. Maybe one of the other docs or Kelly is more up to date than I am.
Yeah, we're getting new information every day. And of course, a lot will depend on our work with the schools and of course with the TEA recommends as well.
Okay, thank you, Rihanna. Let's go back to Hannah Hall with KWTX News 10. Hannah, you have another question?
Yes, can you all hear me?
Yes, uh-huh.
So this is following up again on the double masking. I guess, Dr. Griggs, this would probably be for you unless one of the other doctors wants to jump in. So kind of based on what you were saying, are you still recommending just one mask above double masking, or are you not recommending double masking it at all?
So what you heard Anthony Fauci do was sort of give a sort of a soft positive endorsement around double masking. And I don't want, so here's what I worry about, Hannah, is that there's been so much misinformation about masking in the community, and really just the community finally as a whole, all of us really buying into a shared understanding that this does make a difference, that it really can decrease our case counts, hospitalizations, and death rate. It was so important that I don't want to get tangled up in a dispute around layers of mask or some other relatively minor detail. I say relatively minor because I think that the layers of the masks that a given individual wears is so much less important than just whether or not that individual wears a mask. So I'm not wanting to discourage any mask wearing at all because, or to create a new controversy around layers of mask. So I'm not pushing very hard personally on this issue. Again, I think that for a conscientious, very health-wise individual who has the resources to wear multiple masks or to create a mask that has 3 layers, when they go to HEB or to Target or to Walmart, great idea. Yes, wear a mask that has 3 layers. But I'm certainly not someone who's going to bang my fist on a table or insist or shake shake a finger because someone just has a regular cloth mask over their face. Does that make sense?
Yes, it does. Thank you.
Yeah.
Thank you, Hannah, for that. Let's go to Andrew Moore for a final question. Andrew, you're on the line from KCEN 6, Channel 6.
Yeah, Dr. Griggs, what's the picture like right now for the spread of the B117 variant in Texas? Is that something that looks like it is increasing quite a bit? And what does the risk level look like for that right now?
So we know that the B117 variant is in now multiple states. I think at last count it was 3 or 4, but I honestly, that has been a few days since I looked at it. So maybe in more states now. I don't know. I mean, anyone else who knows could jump in here. I'm not aware that there's been an identified case in Texas, but I do want to make a point that that doing genomic sequencing, that getting a sample and getting it to a lab that can do the analysis of the genome to study whether there's the mutation present or not in the virus is expensive. Not a lot of labs can do it. It's not something where we're looking at 1,000 samples every week from Central Texas. In fact, I think that it's infrequent that samples from Central Texas are sequenced at all, and I don't know that the CDC is focusing on Central Texas at all. They are likely getting samples from Texas periodically, but I don't know the frequency of that. So I think to answer your question, it is that it eventually, if the preliminary data around the transmissibility of the B117 variant is indeed true, if it's accurate that the preliminary data, if it's right that this is more transmissible, then we are likely to see it in Texas and likely to see it in McLennan County. And I think that we should function right now, operate right now as a community as if it is already among us, or it is at least knocking on our door. It's imminent within days to weeks, which again means all of the measures that we've been discussing to date. Does that make sense?
So we can't detect it right now very well is essentially what you're saying, but it's going to be here regardless.
We just aren't. The CDC hasn't announced or shared that they are sampling in McLennan County or this area, to my knowledge. And we don't have, as far as I'm aware, I don't know that we're doing any genomic sequencing in our. I believe there's a lab in Temple that does genomic sequencing at Baylor Scott and White, but I suspect that if they had discovered the B117 variant, that we would have been alerted about it. But maybe Dr. Ahmad can say something about that. I'm not sure.
So yes, our lab in Temple does do the genomics, and we have not identified any UK strain. We did identify one of the different strains coming from Hawaii, which we don't know yet about its transmissibility and also how fatal it is. So there was only one case noted in the last 3 months.
Okay.
Okay, thank you.
Thank you. Let's go back to Brenshavia Jordan now for our final question from Fox 44. Brenshavia?
Yes, this is for Kelly again, or for Mayor. I just wanted to know, I know you said the epidemiologists are still kind of analyzing the results of that survey. And I just wanted to know, when the results are in, will it be on the website? Will it be released via social media? Like, how would we know the results of that survey?
Absolutely. We'll have that information available for you online and on social media as well. So we'll get the word out to everyone about what we learned from this study.
All right.
Perfect. Thank you.
I'd like to thank all four of the media representatives for being a part of our questions today. And Mayor, I'd like to turn it back to you for some final comments, and then I'll wrap it up.
Great. Thanks again just to those participants today. One of the great things that we have here in McLennan County are strong partnerships. McLennan County residents can take comfort in the fact that our hospitals, our healthcare systems, our county government, our city government are all working in conjunction with one another to make sure that this community is safe and healthy. And I'm so thankful for each panelist today. Look forward to seeing everyone next week, and continue to check out covidwaco.com for information, and feel free to reach out to us there with any questions you might have.
Thank you again. Thanks to all of our panelists for being a part of this. Great information. I know our community appreciates greatly the time that's spent. I want to encourage everybody to remember that the Spanish translation of this will air tonight at 4:30. We also have a total replay of this at 7 o'clock on our channel, but it's always available online that you can look at it at any time, probably sometime after 4 o'clock today. I want to remind you also that getting flu shot is still important. It's flu season, and we want to minimize that. And also remember that tomorrow night on our Waco City Cable channel, our live stream as well, the all Spanish version of the Strategic Communication Work Group will be talking about the COVID vaccines and things then too. So we hope you've enjoyed this and appreciate the information in here. We'll be back next week, like the mayor said, and we hope until then you have a good afternoon.